our perspective, seeing people in the club, and let's face it, we can't say these aren't being used. Everyone's using these things. They're out there in a big way. The genie's out of the bottle without question. And we see people who are using them and they feel great because they've lost weight and they feel like it's all working. But when we measure their leanness, measure the actual loss of weight and structure, the loss in composition, the change composition is shocking. They're losing lots of muscle mass alongside some fat loss. And we know where that's going to go. They stop using the drugs, the weight goes back on naturally, of course. And we know now from all the data over a longer period, not just within our own clubs, but externally, all the larger data, is it goes on super quickly because there's nowhere for it to really go add the calories back in again. And we see as well people getting extreme levels of exhaustion within workouts when the workouts also aren't structured as they should be when someone's taking medication. They cannot do HIIT training. It just absolutely wipes them out within moments. They cannot do short recovery work. There's not the energy left in the tank. So we've got to then tweak and change their programs to retain the important factor, muscle mass, strength, and power. You must see it all the time with patients who are doing the same thing.
There's lots of parallels between the health and fitness industry and medicine and longevity. I think one of them is that things have to be hyper-personalized. There isn't really a one-size-fits-all, and we all have different body compositions. And actually, looking fantastic on the outside may hide, a lot of things going on under the bonnet that need to be fixed. And I think the way that you do that is via the really deep dive medically into the sort of, kind of past and making sure that you've done the right tests to show and do all the body composition work so that you know exactly what you're targeting. Then you can actually, so it's not a case of, this kind of logic that the higher the dose, the better the result, and that's sometimes what people want. They want, oh, can you just up the dose, doc? I'm like, no, you need to think about this seriously, because what you're going to end up losing is your complete body composition. So losing muscle mass, sarcopenia is a real problem, I think, for these people. And unless you couple that with the diet, and you think about it, there are so many, supplements that have no evidence at all that people are just taking because somebody's mentioned it. And I know, in the old days of going to the gym, I remember people would always be talking about this with like protein powder and this and that, and there's always something which I think appeals for a quick fix. What's the quick fix that I can do to lose the weight? But if you haven't managed to do it for 20 years, suddenly it might help you on your journey, but it's not the kind of panacea that's going to suddenly make you into having the beach body that you thought you would.